Good evening, listeners, and a warm welcome to Views on Health. A great pleasure indeed to have with me back on the program Dr. Thushara Gunaratne, consultant vascular and transplant surgeon at the National Hospital of Sri Lanka. Welcome back, Doctor. Pleasure to have you.
Thank you, Fatima. Likewise.
And for the information of our listeners, the topic under discussion today on the program is causality of non-healing wounds. Now, from our perspective, a lay perspective, we would think that wounds don't heal because basically a person is diabetic. It may be a cause or a major cause, but if there are other causes that I'm sure there are, which is why you want to focus on this topic, over to you, Doctor, to introduce the causality of non-healing wounds.
Thanks, Fatima. I think, like you said, a lot of thought for diabetes, and it is very important that it is the case. What I want to talk about today is not just simply a topic, to look at wounds in general and why wounds don't heal. And the reality is it's a huge burden in Sri Lanka. If you look at hospital admissions or outpatient admissions, around 40% of all people have a non-healing wound. And normally we refer this as a leg wound rather than the other wound. But so leg wounds are very common. You see it in the people, you see it in different class of people, even from homeless people to professionals to any kind of people, because it crosses the spectrum of the population. So thought we'll talk about why it's a problem, how much of a problem it is, and look at what these causes are. And when you see a clinician, what we as a clinician do to try and find out why this is and what we can do from it.
If I may just comment, you said 40% of the patients have these wounds. That's a big number. And definitely a burden on the health sector.
Absolutely. If you look at any outpatient clinic of any government hospital, a majority of patients are stacked around a dressing room. That dressing room is a hugely congested room because people come so frequently. It's not only the number of people that comes to the clinic, but it's also frequency they come at. Some of them come almost daily, come daily for a dressing. And this incurs a huge cost for the health system to do these dressings. And if you look from the patient's point of view as well, it's such a burden. They need to be seeing a doctor or a clinician or a nurse so frequently, almost every second day, sometimes daily. The cost of that, the impact on their life, not being able to work, and the burden of that from this wound to the family, because some of these wounds aren't pleasant. There are malodor going on, a lot of weeping happening. It affects the patient's family members. It affects his social health, not going around, not visiting people. So it's a huge burden.
Thank you, Doctor. So it is a huge issue. So what are the causes? What brings about this condition that we have 40% of people you see in hospital having wounds, especially in their legs?
Yeah, so I think what I want to talk to you today mainly is that to say one important thing. Normally you and I, if we have a wound, it will heal. We get lots of injuries, falls, we clip on something, small scratches, they all heal. We don't often have wound that doesn't heal. For some people it is a problem. And the most important thing that I want to tell is that it is never a single problem. It is always multifactorial. So when we look at a patient who doesn't have a healing wound, and this, you might ask me, how long do you then wait to say it is not healing or healing not well? So arbitrarily we talk about 6 weeks. If by 6 weeks you've done everything possible, you do it carefully, do some dressings, you see a doctor, and still you don't see the wound healing or getting to that point, or it's getting worse, then there's a problem with that wound. So at that point, there are two important things to think about. Normally for you and I, wounds will heal. It's a natural process. The body has a mechanism for it. If this mechanism fails in a person, then the wound can't heal on its own. And there are two reasons mainly that I think this happens. One is just a general problem. We always look, sometimes as a saying in diabetic foot ulcers especially, we look at the whole in the person rather than the person in whole. a person as a whole rather, because there's a lot of things that require from a general perspective. You might see a lot of people with a lot of long-standing wounds. They're thin, they're not eating properly. The wounds, eating into them almost. They're emaciated. So things like nutrition is very important. You might have all the necessary things going on, but you're not eating well enough. You're not healthy diet, not nutritionally sound, which could be proteins, your vitamins, your micronutrients, your blood cells. All that is important. So we should not forget the general factors that are important to make sure the wound heals. There's one thing I really want to emphasize, because we sometimes look purely at the blood sugar control or the varicose vein or a certain point. We forget that the patient should be eating well, doing a lot of activities, healthy lifestyle, not smoking, not drinking alcohol, eating a lot of fruits and vegetables. All these antioxidants, for example, of the diet are very, very important. So the general health is really important for the wound to heal.
Just a question. Now, when you talk about the general health, granted, what you said makes absolute sense. But can a person with such a wound exercise? He or she may find it difficult to walk about. Then what happens?
True. So I think then there are two types of people, I would say, with ulcers. Ulcers that have been there for such a long time, it's almost part of their life. Especially things like venous ulcers or chronic osteomyelitis. I'll explain these later on, the terms. But these people actually live with their wounds for years and years. And they do get about with their own life, the day-to-day stuff. They do walk around. That part is there. There are also people with more complex wounds, like the diabetic foot people, people who are frail. And I agree, for them, exercise might be an issue. But we forget there are so much of things we can do in our own limited capacity. Even if we can't, let's say, walk a lot, we can do activities, aerobic exercises, doing a cycle, for example, walking around the house, doing activities at home. A lot of people feel like staying on a bed, keeping their leg up for months and months, gaining weight, their blood's not moving around. That prones them to so many other issues as well because of their sedentary lifestyle. So it's really important that they try and get back to their normal lifestyle and be active in terms of their lifestyle, and also get their diet and nutrition sorted out. And there are a lot of things we do for these nose, which might be their own diet, but some people do need some help, and they might need to see a nutritionist, or we may add some supplements in terms of micronutrients. Those things like zinc, selenium, copper, iron are very, very useful for healing wounds, and we recommend people to eat lots of food, natural food that have these in abundance.
Supposing somebody is unable to move, would you say that if they move their limbs, arms, legs as much as they can, would also help? That's some sort of exercise instead of just being in one position. So you stretch out this way, stretch out the other way, you move your legs up and down, maybe your feet, your toes.
Yeah, absolutely. So, I mean, you may have a wound in the leg, but the body as a whole needs to work for it. And your body needs to be driven for it. So it's really important your entire body is moved towards this. So active lifestyle, be some physiotherapy, for example. Having the body geared to heal the wound is very important. And you need to have that in sync when you treat the wound, or when we treat the wound rather, because the wound doesn't heal on its own unless everything else fits in.
What a mental approach, a positive approach. I need to get well. I need to get my leg, better. I need to move. Would that also help?
I think you hit it right on the head in that sense. Your mental health, your spiritual health, they're all important. And I know it's from a surgeon point of view, slightly outside my domain when I say this, but I think we need to look at these long-standing wounds in a holistic way. And you must understand it would already have created such a burden on them. They'll be depressed, for example. A lot of people are depressed, they're socially recluse. It's really important we drive them, both the patient, and I think that's where the family and viewers also get in. Because I'm sure you all have a close relative who has this wound. And I think it's really important you drive them, motivate them. We've got to get this sorted out, because that part of the healing is very, very important as well.
So how do you actually go about this, doctor, in terms of healing, professional medically healing? Now there is somebody with this wound, so the causes could be diabetic, or you mentioned some other technical terms which you wanted to explain. So based on that, the process of healing comes from that.
Sure. So when we see a patient, and sometimes we are at fault for not stressing this general health much enough, but we tend to focus purely on the primary problem that we see. And if you look at a leg, for example, or a chronic leg ulcer, there are few things that are really, really important that drives non-healing. One is vascular, and that's why we are so often involved in it. And when we say vascular, there are almost three parts there. You have the blood supply coming into the wound. Those are the arteries that supply blood. So if the arteries are blocked for many of the reasons we talk about, with atherosclerosis or smoking, then there's an issue in the wound not being able to heal. When you look at the vascular, apart from the arteries, there are also veins. And these are the vessels that bring blood back to the system. And if the veins are faulty, and we call these mainly varicose veins, or patients with DVT, for example, their venous return or clearing of the venous pooling of the legs is damaged. And those people also get long-standing wounds. The third part of vascular is a vessel to a point, but without blood in it. And these are called lymphatics. We heard this mainly with things like filariasis, etc. going on. Not so common now, but patients who had recurrent cellulitis, recurrent infections, they have swollen legs. The lymphatics aren't working. Now, all these causes problems in the blood supply and the way the fluids work in the leg. So vascular problems remain a huge component of why a wound won't heal. Apart from the vessels, those three structures I talked about, the next thing is infection. And infection is basically in a patient who has some immune deficiency of a sort. And diabetes is the classic example of a immune deficient person, where the diabetes causes poor immunity in a person, and therefore infection tends to stagnate. Osteomyelitis is something called infection of the bone. So people with injuries, previous falls, who had metal work in them for various fractures, for example, they might find that if the bone's infected, the wound doesn't heal. Sometimes it heals but comes back again. So some form of infection, again, is a huge driver of poor healing or non-healing. It could be the fact that some component was missed by somebody, and that is why we might be doing x-rays, for example, look at what the bone looks like and various stuff like that. And the third thing is pressure. Pressure as in neuropathy. We are blessed with the sensation of pain. That's what I normally say. Unfortunately, with diabetes and other causes like leprosy, for example, and neuropathy, people don't feel pain. And if you keep on walking on the wound, putting pressure on the wound, if the wound doesn't cause any pain, then that pressure on the wound itself is a huge driving force. So these three, and V for vascular, and I for infection, and perhaps immune, and P for pressure, what we call the VIP of wound, chronic wounds, is a huge driving force. And these three primarily are the biggest contributors to why a wound won't heal. Apart from these three, there are a few other things, and I'll mention a little bit of them. Cancer. Cancer is a known cause for non-healing. Some people have various inflammatory conditions like vasculitis. We may heard of things like SLE, Raynaud, stuff like that happening. They also cause small chronic wounds going on. So pressure ulcers in stroke patients or in patients who are debilitated, who are on a bed. All these causes effects on the body. So what I want to sort of highlight is that we tend to concentrate on these local factors, the factors that affect the wound healing on the leg. And all these are really important.
Thank you, doctor, for that very detailed and lucid explanation. Now, if you talk about, say, the bone infection, that means it is penetrated pretty deep, because the bone, from our perspective, you get the skin, you get the muscles, etc., and then finally you come to the bone. So it has gone pretty deep. So
You're right.
it's a bit of a process, right? In the sense, it's a long-standing wound.
You are right. So two ways it might happen. One is an injury, for example, a fracture, for example, a road traffic accident, or a penetrating injury, and the injury itself might have caused the bone damage, and therefore bugs will get in there. Sometimes it's the other way around. Like you say, it's a very small wound to begin with, maybe a toe. And surprisingly, in some areas of the leg, the bone isn't too far away from the skin. It's not a long distance. For example, around the ankle, for example, on the tibia. So there are some spots where it is very, very crucial. And I thank you for highlighting that, because you need to be aware of those spots. We need to be aware when you look at the wound to think, this could be quite close to a bone, for example, especially with long-standing diabetic foot ulcers, where the foot's deformed. The bones is surprisingly close to the wound because of the deformity of the bones. And we don't often see the bone in the wound, but there are ways that we assess to see how close the bone is to the wound. And if there's bone infection, that infection has to be sorted out, because it doesn't really work very well with antibiotics alone.
So what happens next? How does one treat this? And is there hope that you can heal the wound?
Absolutely. Yes, to your question, all wounds can be healed in some form or the other. And I talk about as to what cost that comes at. But as a clinician, when you see a patient, this is what we do. Our task is to first make sure the general well-being is going on, but we may look at these factors. What's the blood supply like? How are the varicose veins? Are there varicose veins going on? Is there infection going on? How deep is the infection? What is the effect of pressure? Are there possibilities of other causes like vasculitis or malignancy going on? But it's primarily looking at the VIP of the non-healing ulcers. It's a clinical judgment, but we also will need some form of investigations. And as a clinician who's been doing this often, by looking at the wound, a lot of things can be sorted out. By asking the patient some questions: is it painful? Is it painless? Is a lot of discharge happening? How much of a trouble is this for you? Did you have some symptoms before this? For example, a patient with ischemic ulcers might say, be walking, but I've been cramping my leg a lot of time. I need to hang my leg down for the pain to get better. I can't sleep at night. Versus a patient with a varicose ulcer who's been having varicose veins, now having ulcer that is weeping and oozing and exudating. So we rely on a clinical evaluation mainly to try and figure out what might be the likely causes. And as we go along in the treatment, we might do some specific tests to confirm this. And also, the key point in finding this cause is that we need to treat it as well. Because no matter what we put on the wound to dress it, unless we treat the primary problem, we might not be healing the wound. A lot of difficulty for patients and for carers is to try and find that cause and treat it.
So you do find the cause, you have to.
Yes. That's the key point of trying to heal these long-standing wounds. Find the cause and treat it. Easier said than done in some occasions, especially if you look at things like pressure, where neuropathy sets in. Trying to make sure the patient doesn't put pressure on the wound is really, really difficult. These wounds, for example, happen on the plantar surface of the foot, on the heel pad. How can you ask him not to walk? How can we try and reduce the pressure on the wound using special shoes, special footwear? So many things are required, and even then it is not ideal. And I think the biggest difficulty in all of this is the fact that this will take some time. A long-standing wound won't heal suddenly, and we got to really make sure the patient and the clinician are on board on this, because it's easy for the patient to get demoralized, hoping to come to see a clinician, and it's taking some time, but nothing seems to be happening. But it's a process, and as long as the process is done scientifically and with the methodology, it will heal with time.
So this is where the mental aspect comes in, that you address the mind.
Absolutely. And I think the communication with the patient, letting the patient know what's happening all this time. This is what's been happening in the last few weeks. We've been trying to do this. These are the causes. And the patient can also ask their clinician. If you know a friend who's having a long-standing wound, I think fair to ask them to ask the doctor, doc, what do you think? What's the cause for this? What's going on? It's been 6 months now. Do you think you can find a cause for this? So that might generate the person to look for a cause and in turn try and sort it out. And I said, last bit of it was, this will come at a cost. It comes at a cost of finances in any form, if it's state sector or private sector, it's still costly. It comes at a cost of time because you still need to go over see a doctor, do dressings, and it comes at a cost of the quality of life. And I think it's really important patients are on board with this treatment plan, because once it's healed, it's fine, but it's still a process, and it needs a patient who is actively in par with us and in sync with what we are doing in order for this process to be successful.
Because there's no shortcut to this process. It takes its time to heal, and that time has got to be allocated in within one's lifespan, I would say.
Yeah.
To heal totally.
Sure.
You said it can be healed.
So
there's hope.
Absolutely. There's a saying, we don't heal the wound. We let the body heal the wound, but we set the right environment for it. That's what we do. Make sure the right environment is there for the wound to heal. So in our minds, in our practice, we normally set a target of 6 weeks to 3 months, where we really push a lot of intensity that first 6 weeks to try and get it healed. And once you reach a certain point in the wound, there are ways of closing the wound faster. These are the shortcuts you might be talking about. For example, things like putting a skin graft, for example. Use various machines to help this. There are things we can do, but as long as the primary cause, the causality of the non-healing wound needs to be found out. It needs to be addressed and sorted out. Then once the wound starts healing, there are ways we can do to close the wound faster.
Thank you, Doctor. This is really interesting because it's a process that has to be accepted, I would think, in the long term if one is affected. What about surgery? Would you surgically treat any wounds?
Of course. So it might be the wound, might be the cause for the wound. So my practice, in vascular practice, for example, blood vessels that are blocked, they have to be surgically sorted out. Veins that are not functioning have to be surgically sorted out. Infection tends to require surgery on occasions. Sometimes it's purely antibiotics. Sometimes it's surgery to remove unhealthy, devitalized tissue. Especially bone, for example, might need to be removed to make sure that the infection is sorted out. With cancer, there's always a cause. Those things are there. So surgery plays a part. It's also a lot of medical things going on. Make sure the right medicine is there for the patient. It's also about making sure we put the right thing on the wound care, the dressing part of things. And we try to find a nice balance between seeing the wound frequently enough, but making sure it's not a burden to the patient. So some wounds, for example, you can manage to see once a week, for example, or twice a week, and find a easier way of managing the patient without compromising their quality of life. So all these components are there, plus, like you said, the spiritual health, the mental well-being, and the general well-being, all are required. And often it requires the support of family, support of friends to drive this. So the patient is also motivated in all forms, so the wound can heal finally. And the wound can be healed.
So there is hope. That's good news. And just to get a question to come, I would say, going back to what you discussed. So a wound has happened on somebody's leg, either by a fall or an accident or whatever reason. It just could be a cut. There are so many causes for a wound. Now it has happened, and then this is a wound that is not healing after some time, of course. It's been treated and it's not healing. So therefore, the long-term process has got to be accepted that this is going to take time to heal. And the medication and everything takes place, the dressings, everything goes back. Lifestyle, everything that you spoke of. But finally, if you find that the patient is still not healing, will there be such a situation, doctor, in even rare instances?
Yes, I mean, unfortunately, there'll always be about...
I'm not trying to strike a discordant note here, but I just want to know, if there's a possibility of that.
None, absolutely. And I perfectly agree. Most of the time, patients who come to see us, the cause hasn't been found. And the moment we find the cause, we can treat the cause, and the wound heals very fast. For example, if it's ischemia or varicose veins, it heals very fast once the cause is addressed. Regardless, about 10% of patients might not heal their wounds because of many reasons. The general reasons, not being able to sort out things, patient not being compliant. So those things do happen. And rarely we do offer things like amputation. Rarely some people feel like living with the wound because it's been so much a part of them. This is always perfectly fine. The key thing is to be in accord with the patient and finding what the patient wants and helping the patient to get to that end point that he or she wants. And
Yes.
that is what we are there for.
One final question. How receptive have patients been to this process in your own experience?
I think in general, we don't like to accept a lot of things, but it's also, I think, about the rapport and the communication we have with the patient. And what I found out in my practice is that when we speak to the patient and when the patient is on board with what we do, things work very well. The wounds start healing very well as well. Could be the psychology of it, could be the interest that we generate, could be the compliance of the patient because of that interaction. And I think you need to be with the right person who will make sure the causality is found and addressed and manage the wound. But I think it's also important that you have a good understanding with your clinician so that the wound can heal fast as well.
Thank you, Doctor. And I think on that note, your approach seems to work. So good for you, good for the patients. So let's end this interesting discussion on the causality of non-healing wounds on the program tonight. Truly wonderful listening to you, Doctor. It's been a pleasure.
Thank you, Fatima. Thanks for having me.
Thank you to you, Dr. Thushara Gunaratne, Consultant Vascular and Transplant Surgeon, National Hospital of Sri Lanka, for sparing your very valuable time in the midst of a busy schedule to be with us on the program and share your expert knowledge on this very interesting topic. Thank you, Doctor.
Thank you.
Thank you also to Malinta Deshapriya for technical assistance. I'm Fatima Razi Kada saying good night and looking forward to your company next Monday, same time on Views on Health.